You might notice many people wearing pink this month for a very important reason. October is Breast Cancer Awareness Month, a time to highlight the dangers of the most common cancer in women and to rally for a cure. We are already seeing big events across the country celebrating survivors and promoting research to make breast cancer a thing of the past because the numbers are startling. The American Cancer Society estimates nearly 300,000 new cases of invasive breast cancer will be diagnosed in women this year. And the statistics show women in the U.S. have a 1 in 8 chance of getting breast cancer at some point in their lifetime. It's why finding a cure is key. Right now, researchers are working on a life-saving vaccine. Over the summer, a Pittsburgh hospital received a $100,000 grant for a clinical trial to test a new treatment for the earliest form of breast cancer.
This is new and novel because our goal is to see if we can develop a vaccine that helps prevent breast cancer instead of just treating people who have breast cancer.
The trial is starting with 10 patients and will eventually expand to 50 over the next several years. It's a major development in the fight against this awful disease, but it is just one battle in this fight. Here to discuss the other work being done, please welcome Ashton Wells, Associate Director of Development for the American Cancer Society. Thanks so much for being here. Take the time to discuss this important topic and just getting the word out about this. First off, what does this month mean for you and your organization?
Yeah, I mean, every month is a big month, but October is always a big month with breast cancer awareness. It's a great opportunity for us to get the word out about people getting screened. We know that getting screened is the best way for people to fight this disease, catch it early, and get it taken care of when it's still really treatable. So for us, it's all about early detection, get screened.
For sure, and education being such a key
Yes.
component of not just this month. I mean, you see all of the attention
Yes.
around October, and then that's when it really goes on. But I mean, year round, this is an issue. So
Right.
what's being done in our community to get that word out and to get people to the resources they need?
Yeah, I mean, I think there's so many organizations. We're so lucky in Kansas City to have numerous health organizations that have information, but the American Cancer Society, we're always out in the community at different health fairs, talking with employers and health insurance companies to make sure that they have the most relevant information. We, do things like this, and we're just anywhere that we're invited, we go and we try and make sure that people have the information they need. We also have 24/7 information available on cancer.org and through our 1-800 number for people who are looking for information and may not be able to find it locally. There's always those resources.
Nice. Kansas City is such a diverse place.
Yes.
How do you battle healthcare inequity and trying to get people that leg up that they need to get detection and prevention?
Yeah, I mean, I think at the American Cancer Society, we have put a lot of money behind researching health disparities and health equity. We fund local health systems to make sure that patients have access to transportation. We have our American Cancer Society Hope Lodge here, which is a place where patients can stay when they travel to Kansas City for treatment. We have, like I said, the access to resources I talked about earlier, and we're always researching different ways to make healthcare more accessible. We also have an advocacy arm called the American Cancer Society Cancer Action Network, and they are constantly lobbying at the state and federal level to make sure that we have policies that extend healthcare to all people, because we think that fighting cancer is, everyone should have a just and equitable chance at fighting cancer.
Is access the biggest hurdle? And if not, what is?
I think that you can't say there's one biggest hurdle,
Yeah.
but access to care definitely is a major hurdle for so many people, whether that be health insurance, whether that be transportation, time off work to get necessary treatments, someone to watch the kids. There's so much that goes into access to care that we don't really think about on a daily basis.
And
sometimes.
even finances,
Yeah.
because detection is growing by leaps and bounds, and
Yes.
preventative care and that sort of thing. But it can come at a hefty price tag, especially for people who don't have insurance. How do you clear that hurdle, and what do you say to somebody who's worried about going and get checked out because it's going to cost so much?
Yeah, I mean, for the way that it works, especially for breast cancer, both Missouri and Kansas have programs that will help cover those mammograms, and so you just look it up online and see which providers accept that. But in Missouri, it's called Show Me Healthy Woman. In Kansas, it's called Early Detection Works, and it's for breast and cervical cancer. So please don't delay those screenings. If you don't have insurance, there's a resource out there for you, and if you get diagnosed through that program, it'll also cover your treatment. So just make sure that there is funding for that. It's through the National Breast and Cervical Program. It's there for you. just seek it out.
Nice. You know, we talk about education, but fundraising, of course, is a huge component,
Yeah.
especially during October.
Yes.
You have a big event coming up later this month. Tell me about it.
Yeah, so we have our Making Strides Against Breast Cancer Walk. It's going to be on October 28th at Crown Center. It's free to sign up for, and you can fundraise if you're able. It's just a ton of fun, a ton of pink, a sea of pink actually, and just a great time to celebrate breast cancer survivors and honor those that we've lost to the disease.
Must warm your heart to see the survivors make that walk.
Yeah. Oh, it's always so fun, and it's just so fun to see the survivors all interact with, you know, they don't know each other most of the time, but there's a lot of hugs and sharing of stories, and it's just a moment that we can all kind of come together and say, you know, we're going to do something about this.
That's really nice. Well, we appreciate the work you do and the work your
Yeah.
organization does. Ashton Wells, thank you so much.
Thank you so much. Thanks for having me.
If you would like to take part in the big Making Strides Against Breast Cancer Walk, you still can. Sign-up's still available. Again, as Ashley said, Saturday, October 28th at Crown Center. Registration opens at 7:30 that morning. The walk steps off at 9. To sign up and to donate ahead of time, you can go to the American Cancer Society's website, cancer.org/involved, and click Fundraise.